Hi everyone, Andrew Lee here, and thanks for making it to our Medicare 101 webinar. I know some people couldn't make it to our physical one, so we do also have a webinar. For the people that came here directly for the webinar, I want you to leave with 20% more information than you came in here with. That is the whole point of this webinar. If you are confused up the wazoo about anything Medicare and you just are pulling hair because you don't understand a certain aspect of Medicare, hopefully this presentation helps. It's not your job to wake up in the morning and say, hey, I want to take care of this Medicare stuff. It's actually mine. So my job today is to be a great educator and make sure that you completely understand, or at the very least 20%, understand what the heck is going on with your Medicare plan and what is to come with all that's being changed. I also wanted to make this a little bit more easier to digest, so I made it in a PowerPoint form. I'm normally a freestyle kind of presenter, but I wanted this to be organized for those that are visual learners so I can include everybody into what we're doing here today. So let's get this started. What is Medicare? Right? What is Medicare? What actually is Medicare? So Medicare is a federal health insurance program, right? It's a health insurance plan that's provided by the government for people who are generally 65 years and older, right? That is going to be the demographic that most Medicare beneficiaries align themselves with. Now, certain younger people can qualify if they had Social Security disability income. If they've had that for 24 months or 2 years, then they can qualify. Or if there's a situation where it's very rare, if they had end-stage renal disease or ALS or anything serious like that, they can qualify for Medicare. So it's not just for seniors, just so you know. Now, what are the 4 parts of Medicare? This is where everybody gets hung up on, right? The A, B, and C's, the A, B, C, D, and D's, and the alphabets, and the plan G's, and all. I'm not going to confuse you with all of that. I'm going to try to keep this as concise and as digestible, again, as possible. So, again, Part A is hospital insurance. Okay, so Part A is hospital insurance, meaning the beds, the linings, the walls, the actual hospital itself, right? And anything that you have to do at a hospital is going to be Part A. Now, Part A would be taken now automatically if you've been already paying into your Medicare taxes like I am now, right? I am paying Medicare taxes. A lot of Americans are. It's one of the biggest line items on your taxes that you see, so you know exactly what I'm talking about. Well, that goes towards your Part A when you turn 65. So now you have the right to have Part A, right? Sometimes if you're in a situation where you have to get later Part A, that could be a scenario. But of course, if that's a scenario, that's not very rare, but sometimes not the most optimal situation for a regular beneficiary. So if that comes up, feel free to reach out to me. Also, Part B is medical insurance, right? So the doctors that fill the hospital, right? So A and B equals original Medicare, right? Your red, white, and blue card that you receive will say Part A and Part B on it. Now, there is a Part C, which is Medicare Advantage, and there is Part D, which is a drug plan, which I will get into. So one thing to really lock in here and to remember is, really the differences between Part A, B, C, and D. Those are going to be the main ones to really remember. Anything that has plan on it is going to refer to a Medicare supplement. I'll get there in a second. I don't want to confuse you by moving too fast. So Medicare Part A, again, hospital insurance. That's going to cover anything that has to do with inpatient hospital stays, skilled nursing facilities, God forbid if that were to happen, hospice care, some home health care. In certain states are going to have different rules and different programs. So please consult with me on those respective states if that is going to apply to you. And also, the cost is going to be free. Like I mentioned to you, if you've already been paying taxes for 10 years or 40 quarters and your spouse, let's say, is a permanent resident or did not, and they're married to you, as long as they've been a permanent resident for 5 years and you've worked for 10 years or 40 quarters, then they can be on Medicare with you. So Part B is going to be medical insurance. So what does medical insurance cover? What does that even mean, right? The doctors that fill the hospital, so that's going to be doctor visits, outpatient care, preventatives, right? Your yearly physicals, your immunizations, mammograms, pap smears, colonoscopies, prostate exams, things like that. Your Part B is also going to cover your durable medical equipment, anything that's going to be technically medication, but not really, right? So maybe something like a Freestyle Libre, or like something that has to do with an insulin pump, or anything that is considered durable medical equipment, not necessarily a drug, would be covered by Part. They do have some home health, but again, in certain states, there could be some gray areas with that. So please consult me with that. There is a premium of $185 that you do have to pay, and that is going to come in the form of it being taken care of by Medi-Cal if you're qualified for that, because you can have Medi-Cal and Medicare. Medi-Cal is based off of income. Medicare is based off of age. If you do have Medi-Cal, then your Part B is taken care of by Medi-Cal. If you do have Social Security, then you'll see a line item of $185 taken out of your Social Security check. If you are not on either of those programs, then you're going to pay your $185 quarterly. Now, that is going to be quarterly. So when you see your bill come in, don't get sticker shock. That's just your $185 times 3 as of 2025. Now, there is technically a deductible of $257, but I'll get to that in a second. So let's start off with Medicare Advantage. What is Medicare Advantage? So Medicare Advantage is, again, privatized insurance alternative to original Medicare. So original Medicare is going to be your Part A and B, which is going to be provided by the government. Now, you're relinquishing your A and B, even though you still have to have your A and B in place to have your Medicare Advantage plan. Again, these are plans that resemble a regular health plan. These are generally HMOs or PPOs, and they normally have a network. Now, with these type of plans, you do have to have A and B, but they do give extra benefits like flex cards. They'll have additional dental, vision, hearing. They'll have PT. They'll have any type of therapy, x-rays, diagnostic imaging, everything in between, right? So this is sort of an all-in-one kind of plan that does also incorporate your Part D as well too. So there is a drug plan included in your Medicare Advantage. So that's one side of the coin to help cover the lack that Medicare has. So what I mean by that is Medicare only covers 80% of A and B, which is doctors and hospitals. So you need something to cover that up. It's either going to be a Medicare Advantage plan, which you're not completely covering up original Medicare. You're just going into a Medicare Advantage system. And there's also a Medicare supplement, which just supplements that 20% while still on original Medicare. So I'll get to that in a second. But Medicare Advantage Part C is what you're getting on TV, what you're getting in the mail. All these $0 this, $0 that. Now, as crazy as that sounds, most of that is true. Most of the doctor visits are going to be $0. Your deductible is going to be $0 generally. You're going to have, again, more benefits like prescription drugs included in it. You're going to have that. You're going to have vision, dental, hearing, gym membership benefits, transportation, all the bells and whistles with the Medicare Advantage plan. Mind you, you're still within a network. So if this is a good fit for you, if you had, let's say, one doctor you go to and you barely go to that doctor and you take one medication that's a generic, guess what? You might be most likely a good fit for a Medicare Advantage, right? After taking multiple medications, you're going to 17 doctors and 17 medical groups and might have to do original Medicare so you can have the freedom to roam. Again, this has network restrictions, so I just want to give you the pros and the cons. It is going to be in the form of a HMO or a PPO. All right, moving on. We have Medicare Part D. I'm going to keep this easy for you. Medicare Part D is D for drugs. Okay, so anybody asks, what's Part D? D for drugs. So what that's going to cover are your medications, right? Your prescription medications. So this is going to be a monthly premium if you go with a standalone Part D plan. And the donut hole is sort of a complicated situation, but just keep it easy. Some months have more of a copay for medication than others. Now they're working to sort of get rid of it, or at the very least work on it so that it's not so much money up front for seniors. So expect that to come in the future. If I'm wrong, then I'm wrong. I'll take that. But that's just sort of what's in the work right now. Now, with Medigap. So Medigap is also interchangeable for Medicare supplements. Now, what a Medicare supplement is, and again, a lot of people confuse a Medicare Advantage for a Medicare supplement. Oh, I saw that Medicare supplement commercial on TV with Joe Montana and Joe Theismann and all those retired football players. It's actually a Medicare Advantage plan you probably saw on TV. A Medicare supplement plan, again, is just original Medicare that helps with your out-of-pocket costs. Again, you have an 80% coverage for doctors and hospitals with your original Medicare. Now, on a Medicare supplement plan, again, this is the other side of the coin where we want to cover up the 20%. This actually does that. Now, this works with the original A and B, so you don't have to relinquish that. You don't have to relinquish any governmental policies like A and B. You're still going to be on that, but you just have a supplement that covers the 20% that's left behind. So, for example, if you go to the hospital and you had just original Medicare and you had a $100,000 bill, which is pretty easy to rack up these days, it really is, then you're on the hook for $20,000, right? 20% of that is $20,000. If that same instance happens the next month, guess what? That's going to happen again. You're going to have another $20,000 bill. Wait, this happens every single time you have to go to the doctors, that 20%. So we have to fill it up with either a Medicare Advantage plan or a Medicare supplement plan. I'm just trying to give you both options here, just so we're not partial on our decisions. At our agency, we're not either. If I feel like you're a good fit for a Medicare supplement, we're going to go that direction, just knowing what your situation is and listening to your story. If we feel like a Medicare Advantage plan is going to be a good situation for you, then we're going to suggest that. But ultimately, it is your choice. We are here. And we do work for free, by the way. We get credit from the carrier. So it's no skin off your back. So anyways, let me get back to this here. So there's no network restrictions, really, except for Kaiser, right, and a couple other providers. So you're free to roam. This is sort of the peace of mind plan where you can go wherever you want. The only catch is it does not cover prescription drug plans, and there also is a premium associated with this. So on top of your $185 that you're paying for Part B, there could be another premium. Well, there will be another premium with your Medicare supplement plan, your Medigap plan, and on top of that, you have to get a separate drug plan, so it's going to be more itemized as opposed to an all-in-one like a Medicare Advantage. Now, if this is a plan that you necessarily have to be on, then we're going to have to get you this plan, especially if you have more than one doctor that you go to and they're all specialists. Hopefully that made sense. Moving on. So we're going to get into the pros and cons of both. Like I mentioned, I want to show you both sides so you guys can make an educated decision on which plan you're going to go with or which plan you're going to give me a call and say, hey, Andrew, I want that one, or I'm interested in learning more about that one. So Medicare Advantage versus a Medicare supplement plan. What are the pros and cons? Okay, so Medicare Advantage, let's start off with this. So Medicare Advantage, the premiums are going to be pretty low. $185 is standardized for your Part B. Everybody has to pay that some way, somehow, either through Medi-Cal, Social Security, or out of your own pocket. And if you're going to pay that, then your Medicare Advantage is generally under $100, or most likely $0. Now, with a Medicare supplement, of course, this is going to be higher. This is going to be based off of your age, location as well, too, and also the carrier themselves. So the pricing could go up year to year. Now, with your out-of-pocket costs, now for Medicare Advantage, you're going to have copays and deductibles, just like a regular health insurance plan, right? Now, for Medicare supplements, remember that Part B $257 deductible I was mentioning? Now, if you're going to go with a Medicare supplement, and let's say you went with a Plan G, which is the one that I would always recommend just because it is a set it and forget it kind of plan. All you have to do is pay your Part B, which is $257 for 2025. After you pay that, guess what? If you have $1 million hospital bill the next month and you've already taken care of your deductible, you are paying $0 for that as long as that does not include anything that has to do with Part D. If you have met your Part B deductible and you have $1 million trillion expense the month after, you're not paying anything for that, and you can go to whichever doctor you want. There was no prior authorization. There's not even a network. People think PPOs don't have a network, there actually still is a network with the PPO. They just don't have to get prior authorizations most of the times, and also referrals from their primary care physicians. So hopefully that made sense. But mind you, a Medicare supplement plan is original Medicare. You can go wherever you want, except for Kaiser. You can go wherever you want, and after you pay your Part B premium, it's all going to be covered except for your medication. Now, let me give you some time frames on when you should enroll. So you're going to enroll into Medicare when you turn 65 in a 7-month increment. So it's 3 months before your 65th birthday where you can start applying for Part A and B. Again, if you're on Social Security or Medi-Cal, that process will start for you. If you are on your employer coverage or your spouse's employer coverage or on Cover California, you are going to have to pay out of pocket. Again, it's $185 for 2025 right now, and that's going to be in a 3-month increment. Once that's paid off, then you get a red, white, and blue card with your Medicare number on it, and then from there, you will have Medicare. But you do have 3 months before your 65th birthday. You have your birthday month, and then you also have 3 months after, so a 7-month total period to enroll into Medicare or a Medicare plan. Also, with a Medicare supplement plan, they do require underwriting outside of this initial enrollment period. So if you've had cancer, heart attack, stroke, or diabetes or anything like that before, chances are you won't be on a Medicare supplement plan because you won't qualify for it based off of underwriting. So why not use this time to get a guaranteed issued underwriting so that you can get onto a Medicare supplement plan if you know that's the plan that you want during this time. This is one of the most important times of your decision making when it comes to Medicare, because you are new to Medicare. You got to know what's out there. You got to have a game plan because you're going to have this for the rest of your life. Also, get with an agent. I'm 34 years old right as of now, as this video stands. So I'm in this for life. I'm in this for your life, essentially. So I'll be here. If you need help, of course, reach out to me, 323-844-8471. Now, there's also special enrollment periods. I mean, if you just moved from another state, if you had changes where a employer terminated your income or sorry, your insurance, or whatever the situation is, you got kicked off, you had a change in Medi-Cal or Medicaid or anything like that, you do have a special enrollment period where they will give you X amount of days to enroll into a policy outside of open enrollment. Now, you also do have the annual election enrollment, which is a part of open enrollment. So there's two types. There's the annual election period, which is going to be October 15th to December 7th. That's when all the calls and all the craziness happens, because that's when you can change your plans, and you can also disenroll from a plan if you didn't like the plan that you're on the year before. So that's where you make all your changes. And also there is the Medicare Advantage open enrollment period, which right now we're in February, so this is right in the middle of it right now. So this is the crowd that we are now servicing, the people who have made mistakes during AEP, people who saw the plan for what it was, didn't really like it, and they're like, I actually want to go back to my other plan. Andrew, can you help me out with that? Those type of people are the best candidates for Medicare open enrollment. Now, mind you, you can make a one-time switch during this time from a Medicare Advantage to a Medicare Advantage, or you can drop one of the plans and go back to original Medicare during this time. So just mind you that this does exist. Okay, so there's two open enrollment periods, the main one being AEP. Now, here are some common Medicare mistakes to avoid. I need you guys to be educated on this topic so you can make an educated decision. Therefore, you're an educated person and everybody's happy, you're happy, I'm happy, the carriers are happy, the world is happy, right? The world is happy that you're happy. So if you're missing your enrollment periods, there are going to be late penalties. So if you do enroll into Part B later and you are actually supposed to enroll during that initial enrollment period, guess what? There's going to be a 1% penalty that accrues every single month. You do not have that specific part. So make sure that you do get those parts that you have to, right? Part A, your Part A is going to be automatic for the most part. But again, Part A, sometimes you do have to buy into it. Part B, make sure that we have that in place as well too, so that we have original Medicare, so we can get a Medicare supplement plan. There's going to be my website there, and also my YouTube channel, Andrew Lee Health Guy. You can just YouTube that. I'll be there, and feel free to subscribe there, because I will have more content just sort of like this one, uploading there. So if you enjoyed today, I'm happy you did. If you learned more than 20%, please give me a call. Let's talk more about your Medicare options and your plans. And if you felt compelled to do something about this, then yes, of course, give us a call, and we'll be happy to do a consultation with you, and then just walk you through everything like we do with our family. Thanks for watching. Have a good one.